Hi, this is Dr. Girish here. I'm an orthodontist by profession. I specialize in invisible braces, accelerated orthodontics, and TMJ treatments. We also do a lot of sleep apnea remedies. The treatment of sleep apnea in the present day situations, if referred to a general physician or ENT or a sleep medicine specialist, they can just give you anti-anxiety drugs to relax you or something to put you to sleep, but definitely it is not treating the problem, which is your apnea hypopnea index. So unless you do something about that, it's not going to get cured. The main root cause why a disturbed sleep is happening in such sleep apnea patients is because whenever the patient sleeps in the back, because of a gravitational force, the lower jaw tends to go back. Whenever the lower jaw tends to go back, the airway, which is the breathing pipe connecting the nose to the lungs, gets reduced in volume or gets shrunk. Imagine a big pipe where air is flowing, and whenever the patient falls back, the tongue is also going back along with the lower jaw. Whenever the tongue goes back, the pipe, which is definitely, let's say, which is about this much, becomes very thin. So whenever the airway is reduced, when the tongue falls back, the amount of oxygen taken in is reduced, or the patient is deprived of good oxygen in the body. So it is a vicious cycle. Whenever the patient sleeps, there is deprivation of oxygen, there is a trigger for the brain to cause a reaction which causes the patient to get up, and just before he gets up, he clenches his teeth. So it triggers a temporomandibular disc abrasion. So over time, sleep apnea patients end up with temporomandibular disorders. The normal conventional method normally given by sleep medicine or a general physician is something called a Cpap machine. So patient wears something to cause or put some amount of pressure onto the breathing air so that the airway doesn't get blocked. But for life, they are dependent on it. They cannot carry that machine wherever they go. It's quite expensive and it's very cumbersome. So the best method to treat sleep apnea is an orthotic or a night appliance, which we make it. So we record the bite of the patient in the most forward or the protruded position of the mandible, in a relaxed position of the muscles, and then we make something called a night appliance or a sleep appliance. This is the best method as of today to give a good remedy for the sleep apnea patients.